From KETK News, you're watching East Texas Live.
Welcome back to East Texas Live on KETK. Joining us now is Mindy Robertson with the East Texas Council on Alcoholism and Drug Abuse. Good morning.
Good morning.
Yeah,
how are you?
I'm great. How are you?
Absolutely fabulous.
Awesome. So first of all, what is the RNA developed by the PRC for?
Okay, so we have our own lingo, just like with schools or other professions. The RNA is the Regional Needs Assessment, and it's just that. It's data about anything to do with the mental or physical health of individuals in Region 4. Let's see if I've said this one time before. The state of Texas is divided into 11 health regions. Region 4 is the left shoulder of Texas. Starts with Bowie County, goes over to Lamar and Red River, all the way down to Anderson and through Panola. I laugh, but really it is the counties of Region 4. I collect all the data, and we are sponsored by substance use disorder grants, but it's more about what factors, social determinants of health, which is poverty and educational attainment and housing conditions and everything that leads to individuals seeking to feel different in some way, because that's what it is, not better or worse, just different. And when whether it's a high school injury and then they get to college, and if you're moving doctors, then you have an opioid addiction, or some kind of tragedy that's happened in your life. We used to print them, and the Regional Needs Assessment, but they have grown.
Wow.
So now they're available on the website, either at CADA's or the PRC4, which is the Prevention Resource Center for Region 4, and I'm the data coordinator. I talk about all the data. I go to coalitions and news and school boards and city councils, and I say, these are the numbers, but tell me what's happening, and we look at that and compare it and talk to the state and look at funding opportunities. And we're not going to fix anything, but we can grow and create healthier communities so that each period of time, whether that be a year or a quarter, it gets better, that we know what we're looking at and we can heal.
Have those numbers been improving?
Yeah, in some ways. Now, I want one of those church fans that just says because of COVID and just flash it a lot, because we are really making strides, especially, for example, in combustible cigarettes, because we have vaping. We have to talk about the difference in that. We really were seeing a decrease in that until COVID came around, and then we were, people were leaning on things to manage their stress. So we've seen a rapid rise in vaping and vaping other things other than nicotine, but also we've seen a rise again in combustible cigarettes, which we haven't seen in about 10 years. So as far as the other things we're seeing is crime rates increasing. Aggravated assaults, like in Van Zant County, tripled last year. And a lot of it, they're ascertaining that it's people are staying at home. They were there for a long period of time. There's agitated stress. Am I going to pay your bills? Also, home delivery of alcohol was available, and that always increases crime levels and behavior that's probably not suitable to normal disposition of someone.
Yeah, I was going to say if they were linked together.
Exactly. Well, we know mental health and substance use, it's all under the umbrella of behavior health, and it influences everything. I have lots of kids, and I always tell them, find out your why. You know, my son is angry about waffles. Waffles are delicious, they're wonderful, but really he was upset about something that happened at school, but he hadn't put that together to solve the problem of what he was mad about and not take it out on the waffles. As silly as that metaphor sounds, it's really true. Why are we doing these behaviors? Why are we leaning on these things to make us feel different than what we're feeling and what we want to express? And that can be a difficult thing. But like at East Texas Council on Alcoholism and Drug Abuse, they have their outreach and screenings. You can call in, it's free service, and they help you get connected with what you need. They have recovery coaches that will follow you and help you. So there's available resources out there, especially East Texas. We have lots of coalitions and communities that really want to help, but I think sometimes we have that lack of knowledge of knowing those are available. Just like yesterday when Longview had the homeless shelter, the homeless resource center. That was really good to get those services and let people know they're out there, that people can find help.
So where can people get that help? Is there like a specific website?
Well, the great thing about the RNA and it being online is I can update it. And there are 2 or 3 separate, there are lists of coalitions, there's lists of facilities, mental health and substance use facilities, there's lists of all the organizations help, from like One Love Longview to the Hope Center in Anderson County. I try to list all those with links and numbers and who you can contact. Daily I'm getting people say, hey, we just started this coalition, can we be included in yours? And all those are at the East Texas Council of Alcoholism and Drug Abuse website, or the PRC and the number 4.org, and go to data and it's right there.
All right, well, thank you so much for coming on here. We appreciate having you explaining all of this information to us.